Afternoon, you guys. This is a great turnout. So thank you very much for joining us for the Open Day 2022 panel for OT, or Occupational Therapy, and Speech Pathology. I'd like to start by acknowledging the Aboriginal and Islanders past and present, and just make mention that the fact that our local tribes came from three brothers in the dreaming over 10,000 years ago, which I found really fascinating and want to share that with everyone today. I'd like to start by introducing our panel, or I'll actually ask them to introduce themselves, and we'll start with Candice.
Hey everyone, I'm Candice. I'm a third-year occupational therapy student here on the Gold Coast campus. I'm so excited to speak to you all today.
Oh, thank you. Michelle?
Hi everyone, I'm Michelle Bissett. I'm the course coordinator for the Occupational Therapy program, and I'm based here on the Gold Coast campus. Nice to have you with us.
And Kristy?
My name's Kristy Harris, and I'm a paediatric occupational therapist, and I'm also an ex-SCU student.
Woohoo! And Corinne?
Hi everyone, I'm Corinne Cribb, and I'm the Speech Pathology course coordinator here at SCU.
Oh, thanks, guys, and thank you very much for joining us. Appreciate your time on a Sunday. I want to start, Michelle, we want to define what is an occupational therapist.
Okay, I wish I got paid every time I answered this question. Okay, so here's my quick brief rundown. So occupation is the word that we use to describe all of the things that people do in their day-to-day life. So it came originally from the concept of being occupied. So it includes getting up, getting dressed, going to work, going to the movies, playing hockey, all of the different sort of day-to-day activities that take up day-to-day life. So to us, they are occupations. And so that means that we work with a whole range of people who have challenges doing those day-to-day activities for a whole range of different reasons, maybe because of their physical health or their mental health. And so we work with them on what are the occupations that make up important parts of their life and also the things they need to do, and work on sort of interventions to address that fundamentally.
Just while I think that's pretty good. As I said, I've got a daughter in year 11 at the moment, and I'm just like, yeah, speech, OT. I've seen all the graduate outcomes and the things they can do and the variety of work on offer. So I'm a big advocate for both of your programs as well. While we're talking about OT, and I just sort of mentioned it then a little bit, what are some of the specialisations? We've obviously got Kristy here with us today working in that paediatric field, but what are some of the other things that people might do as a graduate?
So occupational therapists work right across the lifespan. So there are occupational therapists working in neonatal intensive care units through to paediatrics, adolescent mental health, rehab for a whole range of different people, brain injuries, stroke, that type of thing, and right through to people at end of life. So as I indicated before, people with physical health conditions or mental health conditions, but also more recently, occupational therapists also work with other community groups. So we now have lots of therapists that work with refugees and asylum seekers who have arrived to Australia and need support with community living skills and how do they create new lives and new occupations in a new country. So quite a huge and varied sort of opportunity of jobs fundamentally.
Yeah, no, thank you. I think it surprised me when I first started looking into it, so I think it's fantastic. Kristy, can we touch on the fact you're one of our alumni, which is awesome, and you're working in the field now. Tell us a bit about your job. What does it look like? What do you do?
So I now run my own business in Tweed Head. So we've got a team of 13 now, which is awesome. We work with children from maybe 18 months up to 18 years. We work across northern New South Wales up to around the Gold Coast area, and out west we work with teachers and schools and families working with children with a range of different difficulties. So they may have a diagnosis, they may have a diagnosis of autism, they may have cognitive delays, they may have genetic disorders, they might have behavioural challenges, they might be struggling at school or with friendships or self-care tasks or all sorts of things. So we really try to work collaboratively with the people that are involved in their lives to try and ensure they're able to overcome whatever barrier they're facing so they can live their absolute best life and have their best future. Every day is different. It's very challenging but extremely rewarding.
Thank you. We've talked a little bit about OT. I think we need to give some speech some love. So, Corinne, can you tell us, we know now what an OT does. What does a speech pathologist do?
Yeah, okay, I have to compete with Michelle's. A speech pathologist essentially assess, diagnose and treat communication and swallowing for all individuals. And again, that's right across the lifespan. So working with young babies all the way through to the elderly. Yeah, supporting them with anything around their communication or swallowing needs, so eating and drinking.
Yeah. And specialisation, so we've touched on that's the whole lifespan. Can you specialise as a speech
Yeah,
pathologist?
absolutely. So we've got a really diverse profession. So we can specialise in lots of different areas, and some of those areas will require people to kind of upskill or engage in that ongoing professional learning once they graduate. So that might be areas like working with really small babies in the NICU for feeding, or with specific populations. So for example, in the disability community or people with autism or cancer care. So there's really lots of different areas that people can go into.
Yeah, no, thank you. So we've had a bit of a chat about what the job looks like. Now we want to sort of touch on the degree itself and the experiences that you might have at Southern Cross. So Candice, as she mentioned, is studying occupational therapy with us. And we know that these degrees are have strong practical components because you need to sort of demonstrate those skills to be able to confidently go out to the workplace. Can you sort of talk about maybe that breakdown to theory, practical, what's sort of expected in your week type thing?
Yeah, so as a third year student, I'm quite far through my degree now, but in my first and second year, there are a lot of allied health subjects. So they are the same across most of our health degrees, but in OT, I am lucky enough that we definitely got to do specialised subjects as well. So, you're doing your anatomy and physiology, learning about the body, but also learning about, as Michelle said, occupations and lifespan. And we're actually lucky enough on the Gold Coast campus to have a daily living lab here, which is kind of a mock home, I would say. There's obviously teaching space in there, but there's a kitchen and a bathroom and wheelchairs. Everything that you would expect to be seeing out in the field is in that classroom, and we spend multiple of our classes learning about that equipment and learning about the modifications and how those things are implemented in the profession. And then obviously we do have some theory components. A lot of our theory is done on our online lectures, and then once you attend your tutorials, you are doing the practical side of things. And then those practical skills are applied into placements. So as OTs, we are completing 1,000 hours of placement over the 4 years. And when you learn those skills in the classroom, you're applying them to your placement. So yeah, it's really fun to be nice and prepared when you go out, but also learning more than you ever could just in a classroom.
No, thank you. While we're sort of having a quick chat about placements, I know one thing that Southern Cross does really well is give our allied health students particularly that opportunity to participate in placements quite early in your degree. So I might get Candice just to sort of touch on that a little bit.
Yeah, so like Jodie said, they do start quite early. When I was moving through my first year, I actually started placement right at the end of my first year. So, you don't want to get to the end of your degree and be in third year, not really understand what you're doing, go on placement and think this is not what I signed up for. So I was lucky enough, to start in first year. I just did a 3-day placement just observing occupational therapists. It was at a paediatric holiday camp, and actually from that I was offered an allied health assistant job for that company. So it's been almost 3 years now that I've been working for them, and it's really nice that because I obviously started my degree in 2020 and having that while I was living through COVID, I wasn't attending classes in person, and so I learnt that from the job that I'm at now. And a lot of the people that I work with are actually Southern Cross University graduates, and so I could ask them questions about my assignments and the coursework. And so being in the field really helps to apply the skills that you're learning on campus in real life and get paid for it.
And I think that's, why we do encourage placements, and we do sort of help coordinate them, which is, again, a point of difference for Southern Cross. You won't necessarily get that at some of our competitive universities, is the university actually organising the placements for you. And we do like to start early because it does help to cement that love for the field that you've chosen. But, yeah, it sort of gives you industry connections and lots of positive benefits, as well as just that confidence in your abilities and developing those skills. Michelle, if I can just sort of, we've got a lot of, I'm looking at the audience and saying a lot of school leavers with us, and I want to sort of let them know what they might expect, or some of the units that they might expect in their first year of study if they chose OT.
Sure. So in our first unit, we have a couple of occupational therapy specific units. So people get exposure very early around the concepts, and as Candice said, you get to see if you're in the right place, I guess. So have a little check in there. But our students also do anatomy and physiology. They learn about the Australian healthcare system, and they learn about psychology and sociology in those early stages of the degree as well. And we also partner with Ginnaby College, so our students also learn about the health of Indigenous Australians as well, because that's obviously fundamentally important to delivery of contemporary healthcare in occupational therapy, but across all of the health professions. So they join with other students from other disciplines in that one as well. And then obviously as we go a little bit further along, then it becomes a little bit less of the other units and a bit more occupational therapy specific, and then we start to go through the paediatric components, the mental health, the adults, etc., etc.
That's great. And I know that the speech pathologist students do study a lot of the same sort of foundational subjects, which is great. I'll get you to sort of have a bit of a chat about that, Corinne. But also, if you can sort of start to then elaborate on whether students need any particular prerequisites to come and study speech pathology with us.
Yeah, so if I start with that, no, there's no prerequisites that people need to come and study speech pathology. Obviously, a passion for working with people and any background or knowledge in science, as well as English or being a good communicator, is going to help. And the first couple of years, as Michelle has described, is similar to OT in that you do engage in some of that shared learning. So again, we get to partner with Ginnaby and understand about the health of Indigenous peoples. You'll do the psych and soc as well, and you'll do the anatomy. And then in first year, we've also got the speech subjects, which focus on more generally an introduction to the profession, so learning about the diversity that a speech pathologist has in their role, because often people will come with one particular interest and maybe not understand how broad the profession can be. So you get to learn about the profession and all of the opportunities. And there's also a focus in that first year around some of the real fundamental skills. So you learn about phonetics and linguistics, so the study of sounds and languages, and also about communication across the lifespan.
Thank you. And Kristy, can I get you to sort of tell us a little bit more about what you love about your job, and whether there'd be any tips that you would suggest to people taking on the degree, or, what they might love about this field once they're working in it?
Okay, so I'll speak from my knowledge as a paediatric therapist. I think there are some children that I'm working with now that are about to graduate high school, the same as some of the people in this room, and I started seeing them when they were in the very early ages of primary school. So to know that I've potentially had such a positive impact on their life, they might have had, a dozen different challenges to overcome, and if I've played a small part in changing the trajectory of that person's life, that's amazing. And, when they're an adult, they may not remember my name, but I hope they remember that really lovely lady that used to come and see me at school, once a fortnight, or that person that came into my home and helped me to do this. And I couldn't do that then, but I can do it now. That is empowering, and it's so fulfilling. I'm so blessed to be in a profession where no 2 days are the same. You're presented, if you like challenges, if you like thinking on the spot, if you like being creative and being fun, if you like engaging with people, if you like learning about how the brain and body works, then I would say occupational therapy is for you, regardless of which particular field you might or a speciality you might go into. It's amazing and diverse. And I forget the last part of your question because I just got on a rant.
Any tips?
Any tips for students? Yes, when you come into your degree, I would suggest coming in with an open mind. As Candice said, there's 1,000 hours of work placement that you can do during your degree. You don't know what's going to tick your boxes until you're in there and you're doing it. So come in with an open mind, be a sponge, connect with your lecturers, stay in touch with your supervisors on placement. We take a lot of students from SCU. We've set up a student clinic so they have an opportunity to actually be really hands-on through their placement experience with us. I'm still in contact with some of my lecturers. They still support me today, and I graduated in 2013. So those connections are so valuable. They will help you for your entire career. Be organised, say yes to everything, and come and get excited because it's a great pathway.
Thank you. I just want to touch on the fact that Southern Cross University's introduced a new model of study. A lot of our courses were rolled out this year in 2023, and our health courses will move to this new model next year. So this is where you'll, rather than concentrating on 4 units or 4 subjects at any point in time for a 12-week period, you'll just concentrate on 2 units. So it gives you the opportunity to really focus in on those 2 units. So our health courses are transitioning into this new model next year. While we're sort of talking about concentrating on units and knowing what your commitments look like each week, I'll throw to Candice just to ask about, what's the expectation if you're a full-time student in terms of what you should commit to your studies?
Yeah, so I would say that currently I'm in the semester model, so I have 2 12-week blocks, and I'm on campus 2, maybe 3 days a week for my subjects. And like I said earlier, all of my lectures are online. So once they're released, I kind of get to choose whether I commit a whole day to all of my lectures or do them throughout the week. So I personally wouldn't recommend I have 3 jobs just because I'm a little bit of an overachiever. But I work as a student ambassador here, and then I also work as the allied health assistant, and I work at Rebel Sport, but they are just things that fill my time, and they help me save money for my placements, but I can very easily hold down those jobs as well as study full-time. And so, yeah, when I am on placement, I don't obviously work as much, but a lot of times I have been on placement and still been completing assignments for university, and it is very doable. There are so many support services at the university which do help with that. There's uni mentors, and you hear from students that are older than you, and they're always there to support you. So, yeah, my week, I would say 2 or 3 days on campus, and then maybe 1 to 2 days study assignments. And yeah, I can still hold down a real work-life balance, which with the new model is the key factor, that you will only have to focus your brain power on 2 subjects at a time rather than 4, and you'll definitely see results come from that.
No, thank you. I just wanted to sort of ask you guys, was there anything that we need to sort of share with the audience today? We've got previous questions have been around accreditation, like, if you graduate with a degree, do we need to do anything else to be a practicing OT or speech? So I'll start with you, Michelle, and then Corinne, if we can sort of touch on that one first.
So in occupational therapy, all of the programs in Australia undergo accreditation to meet particular national and international educational standards. So that means that we have some consistency. The degrees look different, but it means that you are able to be employable at the end of it, which is ultimately the most important part. So we have that accreditation. We actually have ours starting tomorrow, so it'll be a sleepless night tonight as we get ready for that. But that happens for us every 5 years. But to practice as an occupational therapist in Australia, you need to be registered with AHPRA, which is the Australian Health Practitioners Regulation Agency, and they oversee the registration of a whole range of health professionals, doctors, nurses, who else is in that list? I'm trying to think. Podiatrists, osteos, there's a whole range that sit within there. So yes, you need to pay registration every year to be able to practice as an occupational therapist in Australia.
Oh, thank you. And does the same apply for speech
No,
pathologists?
it's actually a little bit different. So similar to OT in that we also have a professional body, or our peak body is Speech Pathology Australia. And so we really encourage students to be members of Speech Pathology Australia as student members and post-graduation. But actually for speech pathologists, that's not compulsory. That's optional, but of course strongly encouraged and is a great benefit to you in your profession.
Thank you.
Yeah.
So we've only got about 5 minutes to go. So I just wanted to make mention of the ways that you can actually come and study with us. So if you're currently in year 12 at high school, make sure that you ask questions about our early offer program. So this is in addition to the choices that you'll make through UAC or QTAC. It's completely separate and it's based on your high school's recommendation. Costs you nothing. It's just a great opportunity to come and study with us. So make sure you ask questions about early offer. Obviously, there's the UAC and QTAC preferences. You're welcome to, we'd love to see you put them down for Southern Cross on the Gold Coast to study either of these programs. And you're also able to apply directly. So this is open to our non-school leavers that might have had a little bit of break from study for a little while. They're welcome to apply to us directly. It costs you nothing. It's easy to do. You can find how to apply on our course pages. So you'd simply go to Occupational Therapy, for example, on the course page, drop down to how to apply and follow the steps from there. Same with speech, find that course page and go from there. So I'm just going to open it up to the audience to ask if there's any questions of our panel today. Just know that we will hang around. So this is our last panel for the day. So we'll stay in the room. So know that we will be here and our team's here. I think we're finishing off some campus tours. Hopefully you've done one of those. If you haven't had the chance to do a campus tour today, our team, the Future Students team, are offering them every month from next month, September. I think it's the 1st and 3rd of September. I think it's the 1st of September at 1 and 3. So just, go to our webpage and Google campus tours and we'll happily show you around if you didn't get the chance today. So any questions at all, you guys? Yep.
I think it was Candice mentioned it was like 2 to 3 days on campus. I'm just wondering if it's the same sort of thing for speech pathology.
Similar structure. So you can expect to probably have at least 2 days, perhaps 3 days on campus, which is your tutorial, so your face-to-face learning. And then as you progress through your degree, so commencing in second year, you also will have about 1 day of placement. So that could be on campus in one of our internal clinics or out in the community.
And it's a great health clinic that we've got too. Yep.
I was wondering what the timetable would look like for an occupational therapist.
In terms of as a student or, Did you guys want to touch on that?
I can. So with the new model, it will be 2 subjects for 6 weeks, and then you have 2 weeks off. So within that 6 weeks, I might pass over to Michelle on how many hours that is.
It will have some online classes, so it'll have, I'm going to speak generally, so generally they'll have an hour will be an online workshop which will have our students from the Gold Coast and Coffs Harbour together in that online space with the teaching staff, and then the tutorials will be either 2 or 3 hours depending on which ones they are. So you're probably looking at about 4 hours of contact point for each unit per week, and then there'll be a whole range of online learning that will happen across the week as well.
With another question, yeah?
So for OT, when exactly are placements? Like I know Candice touched on, like she did it towards the end of first year. Is that still currently the thing, like end of first year?
Yeah, it is changing a little bit. So our first placement will now be at the end of second year, and it will be a simulation block. So it'll have some time here on campus, but it will have a lot of simulated learning through case studies. And then we will have an 8-week block at the end of third year and a 10-week block at the start of fourth year. And I should point out too, because this question always comes up, where are the placements? And the placements are literally anywhere across the country. So some students need to stay locally for particular reasons, but actually we really relish the opportunity to be able to send our students interstate, particularly to regional areas, because the learning experience is so different. And again, with the opportunity to work with people from Aboriginal and Torres Strait Islander background communities as well. So we have students up in Cairns. They've been up to Darwin, down to Tassie. We see that as a real opportunity and a great opportunity for students.
Same for speech.
Yeah, we're actually really fortunate that, again, we've got lots of partners far and wide. So we've just had some of our fourth years in their final blocks up in Darwin and Townsville, and some more locally just at the Gold Coast or in northern New South Wales. So again, obviously we're considerate of people's circumstances, but it's really nice for you to be able to get that diverse placement experience. Will help you develop those links in the profession as well for your post-graduation life. Yep.
I think you were just in Cairns, weren't you, just recently?
I was just in Cairns. I spent 6 weeks up in Cairns for my third year placement, and it was absolutely incredible. I worked in the hospital there on the surgical ward, and like Kristy said before, I was a sponge. I went home every day and my brain just felt like it was going to explode. I was learning so much from so many allied health professionals, and being out there in a different community with a lot of Aboriginal and Torres Strait Islander peoples, and we had people from as far up as Thursday Island and the Torres Strait, which was really interesting to have something completely different to all of my other placements. So it was a very, very good experience.
And I think just, I touched on it with a few people as we were sort of entering the room. The graduate outcomes are so amazing. Like, is it 96%? I think
100.
Yeah, well, there you go.
100%. So all of our graduates were successful in seeking employment at the end of last year. So that's, I think, as you mentioned at the start, lots of health careers at the moment are really in demand, and I think speech pathologist is actually the highest at the moment, with open vacancies in SEEK. So it's definitely a profession that you'll be able to seek employment in. And again, it's a job that you can carry right through your working life and still, move into different spaces over that time to give you that diversity in your career as well.
I think, those opportunities are in regional areas, metropolitan areas, like the list is endless. But any other questions? We've got another one. Yeah.
We haven't touched on osteopathy. Obviously, there's no one on the panel. So in your first year of health, what's the crossover for the subjects between OT, speech and osteopathy? Are there a lot that crossover, same subject?
I think there's a few foundational courses, or units, I should say, that all of our allied health take. Did you ladies want to add there? I know it's not your specialisations, but
I think there's around probably about half, I'd say, about half your load, or that's the case in speech anyway. About half of your load is shared with other health disciplines, and then we've got the other half in more speech-specific units, yep.
And what we can do, because I know you guys were interested in that osteopathic studies and the young gentleman behind as well, we can put you in contact with some academics in that space, and you can ask some very specific questions around the program if you like. We can do that today. Well, thank you. Oh, another one? This is
I was just wondering what placement looks like within the school and in the community. Are you working with different types of people, like kids? What does that sort of look like?
So our responsibility as an education provider is to give our students a variety of options in their placements. So, for example, you wouldn't have 3 paediatric placements, and likewise you wouldn't have 3 palliative care. So we try and mix that up as much as we can across hospitals and healthcare systems, community-based, things like the National Disability Insurance Scheme is a big area of employment now, so we like to send students there, and again across the lifespan as well. So we might have some student do a paediatric placement, but then go to mental health to do young adults and adults the next time, and then maybe something in aged care. So we really try and get as much variety as we can.
I think we'll wrap it up, guys, but just know that, one more. Oh, sorry, I missed that. Sorry.
One more. I was just going to ask, are the disciplines all kind of geared evenly to community work versus hospital work, or is there a strength that you have that sort of seems one way for courses?
I think we've actually fortunate enough to have really strong partnerships across both of those populations. I think one of our strengths is obviously the Indigenous health major, which is an opportunity for us. So that definitely gives us, again, another line of kind of community partners or hospital and health settings. For speech pathology, it's definitely split. You know, we've got placements in all of those settings that students will have an opportunity, as Michelle has described, across their progression throughout their degree to engage in those different environments. Yeah.
Yep. All good. Well, thank you very much for coming along today. I hope you've got something out of Open Day 2022, bit of a mouthful. As I said, please reach out to our Future Students team if there's any questions that you have. As I said, we'll put you in contact with academics if they're very specific questions around the course material or help you to apply, you know, accept your offer and all of that sort of stuff. We're here to help. So best of luck with your future studies, and we look forward to welcoming you to Southern Cross. Thank you.